Hello and welcome back to UIUC's Biology Today podcast. I'm Nini and I'm here with my co-hosts Elizabeth and Keisha. In this episode, we'll be diving into mutations, specifically focusing on sickle cell anemia. We'll be discussing what it is, the genetic mutation that causes it, how it affects daily life, and possible treatments. We will also have a guest appearance from Dr. Achal Anand, an expert on sickle cell anemia, further explaining the heritability of this disease, its history, and a fun fact that not many know. Today's episode is sponsored by McGraw-Hill Connect, helping thousands of students further understand biology and providing online learning support and tools at your fingertips. With this, let's dive into today's topic. Let's start off with a big question. What is sickle cell anemia?
Thank you for the introduction. And before we really delve into things, I just want to say thanks for bringing me on the podcast. I've been a longtime listener, and it's great to see what you guys do. Let's get into it. So, question might be asked: what is sickle cell? Well, the formal definition of sickle cell anemia, according to Mayo Clinic, is a group of inherited disorders known as sickle cell disease. It affects the shape of red blood cells, which carry oxygen to all parts of the body. Now, that might be a bit jargon and everything and so on, so let's get into maybe what causes it. That might bring a bit more familiarity to this. Well, sickle cell is caused by a mutation in one of our genes. It's known as HBB, and this gene is responsible for creating the protein that codes for hemoglobin. Hemoglobin, of course, being the protein in red blood cells that carry oxygen to our organs. Very important. So this hemoglobin, created by the cell, which is mutated, they start to stick together, which causes the resulting red blood cells to be misshapen, which was a bit of information from fellow review of natural history of sickle cell disease for you there. But, how do you even get this mutation? Well, it's most commonly inherited from parents, and as it is a recessive trait, both parents have to have the trait, either phenotypically or genotypically, which means either they show the trait or maybe it's just recessive for the child to inherit it. This is why sickle cell anemia is called an autosomal recessive genetic disorder. And to just give you a bit more of an idea, doing a little bit more of a deep dive into sickle cell here, it's important, I think, to look at the history of it. Why is it in our population? Before we get there, the first description of sickle cell disease was by a physician from Chicago, by James B. Herrick. You see, Dr. Herrick noted in 1910 that his patients from Caribbean had anemia, which is a lack of healthy red blood cells to adequately oxygenate blood tissue, which is fancy talk for saying there's not enough oxygen for the blood cells, means not enough oxygen for the organs, which is not very good. But he also noted that it was characterized by unusual red cells that were sickle-shaped. Further research 17 years later, in 1927, by Hahn and Gillespie, proved that this sickling, they called it, of red blood cells was correlated to low oxygen, which is commonly referred to hypoxia. Then, in 1940, scientists were able to determine that the construction of these sickle-shaped red blood cells couldn't oxygenate to the expected levels through birefringence, which is not too important, but it's a phenomenon in which an instant ray of light splits into two rays of deoxygenated red blood cells and gives scientists the ability to determine the construction of these red blood cells. Now, an interesting fact about sickle cell is that it was originally widespread throughout Africa, and even nowadays the higher percentages are found in Africa because of its known assistance with malaria. Its correlation has shown that higher populations have sickle cell as a result. So much, in fact, that the mutation occurred at least 3 times independently on the African subcontinent, in places in Benin, Senegal, and the Central African Republic countries. Now, the mutation, if we want to get more into the scientific talk here, is in the hemoglobin beta gene, the HBB gene, which is located on chromosome 11, causing this sickle cell disease. The abnormal hemoglobin, which is called hemoglobin-S, molecules stick to each other, forming rod-like structures, which changes the cell shape from circular to still and sickle. These cells have a tendency to get stuck, as I mentioned before, and pile up, which is what caused that deficiency of oxygen that previous scientists noted. And when our organs don't have enough oxygen because of this, they become damaged, and tissues become damaged too, and in the end, people are affected.
Yes, thank you so much, Dr. Utchel, for such an in-depth look at what sickle cell anemia actually is. And I think just to pick up where you're kind of leading our conversation to, how does a sickle cell affect daily life and some of the struggles a person with sickle cell might face? One of the main struggles with sickle cell is pain management. Some people who suffer from sickle cell anemia have a constant chronic pain, or they may even have something called vaso-occlusive crisis, which is a sudden debilitating pain. And it could have been, there are possible triggers for these pains, such as dehydration, extreme temperature, high altitude, stress, and alcohol. Another issue for people with sickle cell anemia is infection management. People with sickle cell are at a higher risk of infection, so it's extremely detrimental that proper vaccinations and antibiotic treatments are taken, as they are completely necessary. General fatigue is also a problem with sickle cell anemia, and especially for, this is a different problem, but people with sickle cell anemia can get pregnant. However, there is an increased risk during pregnancy of other issues forming. So after hearing how it affects daily life and the struggles that someone might face, a lot of our viewers may be wondering, is there a cure? And I believe Elizabeth can speak a little bit more to this.
There is no known cure to sickle cell anemia, but treatments can help manage conditions by relieving chronic pain and help prevent further complications. Certain medications and blood transfusions can help manage these symptoms. Voxelotor is a type of oral medication that is taken by patients over the age of 4 to prevent red blood cells from forming the sickled shape and binding together. This can reduce the amount of destruction and can preserve some red blood cells. Other forms of medications include analgesics, which can help reduce pain during crises, and antimetabolites, which reduce episodes of pain and can stimulate conditions of normal productions of hemoglobin in the body. Procedures like bone marrow transplantation, also known as stem cell transplantation, involves the introduction of healthy bone marrow stem cells from a donor. Certain therapies, such as intravenous therapy and oxygen therapy, provide supplements to the patient through intravenous fluids or through a mask. There are no foods that should be avoided, but it is recommended to eat foods rich in folic acid and calcium.
Thank you so much to all of our speakers today, and thank you for listening. I hope all of you enjoyed learning about this fascinating disease and got a better understanding of how this mutation affects people's day-to-day lives. If you are interested in all things biology related, make sure to tune in next week where we discuss how mutations can lead to cancer. Once again, thank you to our sponsor, McGraw-Hill Connect. Make sure to subscribe for more episodes from your favorite podcast. This is UIUC's Biology Today, signing off.